Good afternoon. Welcome to our webinar today. This is the first of two webinars that we're going to do this spring on controlling cell count and hopefully give you some good ideas to get a really good start to your cell count control on farm for 2024. We're going to record today's webinar because it might suit you better to listen back later on, and we'll make that available on tirlánfarmlife.com. We also are open for questions, so any questions that you've got, please email them to us at questions@tirlánfarmlife.com or text them to 086 180 3947. Thanks for joining us, and let's kick off. So today I'm joined by Joris Somers, who's our vet in Tirlán, and also Finola McCoy, who's the CellCheck Programme Manager from AHI. We're really just going to have a very interactive discussion. I've got lots of questions that people have sent us in ahead of time, and I'm just going to kick the questions over to the guys and get some really good feedback on what actually are the practical steps for staying on top of cell count this spring. Joris, a lot of you know, he's been our veterinary advisor for almost 5 years at this stage. He's got wide experience in dairy and in dairy health, internationally and nationally. He, along with myself, were members of the AHI CellCheck implementation group, and he also works with the AHI other programs around animal health, such as Yones and things like that. He's also completed the training for the CellCheck TASA dry cow consultations and the CellCheck Solutions Programme. We're also joined by Finola McCoy. Finola is the CellCheck Programme Manager. So this is the 10th year of CellCheck for Ireland, and that's the other health programme. And that's really been about bringing the industry together so that we make sure that we're giving the best advice to farmers and actually really joining up the industry so that as farmers, you're getting the best possible messages to help control your cell count. So let's start some of the questions. And as I said, keep texting them in to us on 086 180 3947 or email them questions@tirlánfarmlife.com. So I suppose the main question that everybody wants to ask at this stage is, how to manage the spring. And one of the things that actually gets asked a lot on farm at the moment is, how do I manage cows that are actually currently milking, which are high in cell count? So a lot of people might have milked through this year. So how to actually stay on top of those cows before you've got the spring cows coming in. So Finola, to you first. What should I do on farm to manage cows that might be high in cell count and they've been milking through?
Thanks, Finola. Okay, so dealing with cows that are currently high in SCC, the first most important thing is to know who they are. So to identify them and to know that you have all of those culprits identified. Sometimes it's the ones that we may not suspect that could actually be, could actually have a high cell count. And therefore, I suppose the thing to remember is if they have a cell count over 200,000, then they have at least one infected quarter. There mightn't be any clinical signs, but there's still a potential source of infection. And that's an important thing to remember in terms of the other animals that are now joining the herd or that have calved down and are just starting milking. How do we protect those if we have some cows that are being milked that are a source of infection? So, like I said already, identifying them. So either through milk recording or using a CMT to know which cows and within that, which quarters. Once we know the cows that are affected, we have a couple of different options. And I suppose even to refresh on some of this information, I would direct you to the CellCheck farm guidelines for mastitis control. They're all available online. Management Note M specifically focuses on dealing with high SCC cows. So if you need a reminder of some of these points, that's where you'll get all the tips from. But for those animals that have a high SCC or an infected quarter, treatment may be one option, but the reality is if they're at boards, if they've been milking through, if they've had a long lactation, then treating them during lactation or while they're still milking, the probability of curing may be pretty low. So it's certainly not, the guarantee, and it's not necessarily the action that I would jump to. Drying them off is obviously an obvious, or I suppose a logical option in terms of preventing the spread of infection and also minimizing the impact on the bulk tank SCC. Alternatively, drying off a quarter, although at this time of year you probably have enough to be managing without adding three-quarter cows to the equation. But an important point to remember is, in terms of protecting the other cows, is if you know you have infected cows, is keeping those last. It's not milking them, not milking them in the middle of the sequence. If you milk those cows and then take the cluster off that animal and put it onto probably the next 5 or 6 cows that are milked with that cluster, there's the potential to spread the bacteria from the first cow that was originally affected to the others that may be at a vulnerable stage. They may just have calved and be in the early stage of lactation, so they're at risk. Really, it's important, I think, to make decisions on those cows, knowing who they are. And at this point in time, unless there are strong reasons for continuing milking them, I would be looking at drying them off, particularly if, as we're heading into the intensity of calving. Joris, you may have other suggestions to add.
No, those are all very good suggestions, obviously, Finola. I think what we have to stress a little bit maybe this time of year, especially with the spring calving starting, is that the cows that come out of a dry period and have a high cell count, we need to look at, is it something they picked up during the dry period, or was it something they are carrying through the dry period? So they were high in cell count before being dried off. Whatever dry cow treatment was used didn't work, and now they are coming back into the herd with a high cell count, and they're a huge source of infection for all the other animals. And a lot of herds have heifers calving down now, maybe even the first animals to calve down in the herd. These are the future of the herd. If they pick up an infection from one of these high cell count cows early on in their career, it could be career over for them. So that can have a huge impact. So it's about knowing which cows to really keep an eye on because they were a problem last year, and then keeping a close eye with the CMT paddle or a milk recording to see how bad are they this year and take action quickly. And I think the culling, in a way, could be a hard decision at the moment, but actually it's much easier to do it now than wait 5-6 months from now and the cow is in calf. It's much harder to cull a cow then. So actually I would really look at those cows as being the big culprits and the big source of infection in your herd, and actually take action quickly on them.
Sorry if I could just add, Joris, it's a really valid point, and I suppose it raises the distinction, or we need to be clear, and this is where some of the conversation needs to happen, to discuss these decisions with your vet, with your advisor, and rather than just making a decision for the sake of it. But I suppose it's interesting because, I was thinking in terms of cows that have continued milking, over like that, they haven't been dried off, which could be a very different scenario to those, as you say, Joris, that are calving down with a high cell count. How we deal with them could be quite different, and the long-term decisions, the strategies may be slightly different depending on their situation. So all these things have to be considered.
So really picking that up from the peer review, it's all about identifying your cows and knowing what you're dealing with when you're starting off, whether they've milked through or whether they're coming in. And I suppose, to be fair, that leads me straight to the second question. The cows calving down now, and everybody's really at that early part of calving where you've got a lot of cows calving quite quickly, and you're going to be very busy with calves, you're going to be busy with housing. The weather is going to be changeable in the next 4 or 5 weeks, let's face it, so things won't be easy. So what are the top tips that you can give farmers at the moment facing into calving now, or right in the throes of it, how to manage cows as best as possible when they come in to ensure that cell count doesn't get away? Because sometimes what we see is that cell count can get a little bit high in spring, and if you don't bring it back in spring, it then becomes a problem and stays a problem for the rest of the year. So what are the best ideas that you can give farmers today? Joris, do you want to start off on that one, please?
Sure, and look, there is obviously quite a bit of overlap in how you manage cows that maybe are milking through the winter and the ones that are calving down now, and how you manage them. I mean, a good milking routine is something that is vital to all of this. But with freshly calved cows, or cows coming up to calving, is actually where I would start nearly, and go back to your calving pen hygiene even, because we do see quite a lot of animals that potentially pick up infections in those last couple of days or the week before calving, and that has to do with calving pen hygiene. And so if you think about the dry period and how susceptible cows are for an infection during the dry period, the risk is very high at the start, then it settles down through the middle of the dry period, but the risk of picking up infection really increases again as the animal gets closer to calving. And a lot of farmers will question, cows springing but actually leaking milk. If milk can come out, bacteria can get in. And if you keep that in mind, you really have to focus on the hygiene around the calving, and then these animals coming into a parlour that has been serviced. New rubberware, anything that catches or touches the cows is going to be a potential vehicle in which the bacteria can spread. So whether or not you actually stopped milking altogether during the winter, or whether you did milk through some cows, it's always a good time to start with a new set of cluster liners. And we can debate how often, or we can't really debate, but we can start calculating how often this should be done for every farm. But a lot of herds will still be hung up on the every 6 months I'm changing my liners. But actually, when you do the sums, because herds have expanded over the last couple of years, it actually ends up being maybe every 4 months. And so I would say, well, why not take this time now to just change all the liners, have fresh liners at the start of a new lactation for what is going to be the bulk of your cows. And at least then that's a starting point from there on, and go from there. As part of the routine, obviously, you want to be looking at your teat disinfectant and how that is applied. And I'm often asked, what's the best teat spray or teat dip? And there isn't really such a thing as the best teat spray. Technique in which you apply it is actually much more important than the concentration or the type of product, really. Teagasc have done some really, really good work, both in the lab and on animals, to see which disinfectants are most effective. And across the board, I suppose, across all the different bacteria, they would have found that a chlorhexidine is always going to be a good choice, or a combination of chlorhexidine and lactic acid. And then when you look at the concentration of those, look, you do want some level of it, but there isn't necessarily a link between the very high concentration being the better a teat spray. So you're looking at chlorhexidine at 5,000 ppm, for example, would be a good starting point. Or if it's in combination with lactic acid, you could probably drop that to 3,000 parts per million. But then the lactic acid needs to be there in a significant level as well. So, 2.5% or higher. If it's just a token, it's probably not going to be as effective. But at the end of the day, it's about using plenty of this product on all 4 teats, covering the full length of the teat barrel, not just the tip of the teat. The cows really need to be dripping in this. When the cluster comes off, you go in quickly and you spray these cows. Don't do it as they're already walking out of the parlour and the cows are just walking through a cloud of disinfectant. That doesn't work. Okay. I suppose one of the things at the moment with cows still being housed is, can you prevent the cows from lying down in cubicles straight away after being milked? So can you either lock them at the feed barrier if you have lock and head gates, or is there a way that you can keep them in some sort of a clean collecting yard type setup where they don't have an option to lie down? Because for the half hour after milking, the teats are still very open. And so that allows access to bacteria. So keep those cows standing for at least half an hour. After that, they're actually okay, and the teats will seal over a bit, and that will prevent bacteria from getting in. So it's those sort of, I suppose, actions that we can take every milking that will do a lot of good and can prevent worse from happening. And then overall with the housing, especially the hygiene, run the scrapers often enough, make sure the collecting yard is cleaned and scraped before the next milking, so that the cows don't come into the dirty collecting yard. And look, if you need to CMT cows, absolutely go for it. But bear in mind that the CMT, it's not the most sensitive tool that we have. It will pick up cows that are 400,000 in a quarter, for example. And those are your bigger offenders, and that's fine. That's a good starting point. But you're not going to pick up a cow that's 250,000, for example, with a CMT. You have to be very experienced. They're very good at it to pick up cows that are 300,000, for example. So I would sort of look at those things for the freshly calved cows anyway.
And Finola, anything to add to that one?
Yeah, I guess the only thing I would add to that is the stockmanship and the handling of the animals, bearing in mind that it can be quite a stressful time, not just for young animals, but for experienced girls as well. They've gone through a major transition. They've calved, they've started lactating again. So physiologically, there's a lot going on. So minimizing their stress, which in reality will, can also minimize your own stress too. Just in terms of trying to slow down a little bit and not rushing them, and making things a little bit easier for everybody. Because there's nothing harder than trying to milk or handle stressed animals. If we can just keep things calm and keep things quiet, everybody, including the animals, will benefit. And as Joris has mentioned, like hygiene is essential. If you think that, if you remember that the only way predominantly that mastitis can happen is when bacteria get in through the open door, and that open door is the teat end. So if we can keep those bacteria to a minimum, and if you can keep the teat end as healthy as possible and mind it, protect it as much as possible, then they're the key things in terms of preventing new infections. I would also say, I suppose once you get a chance to have a little bit of a breather, is also investigating any potential problems. Don't just assume that a rise in the SCC in springtime is normal to be expected and it'll all sort itself out. It may not. And the reality is some of those infections may become well established and do a lot of harm throughout the rest of the year if they're not addressed early. So the best opportunity to get on top of it and prevent it becoming a problem is acting early and investigating the problem. So as Joris mentioned, using the CMT, it certainly won't pick up all of the animals, but it will certainly identify a good proportion of those higher SCC ones that we can, that you can make decisions on early. And also book an early milk recording. Get started on that milk recording early so that we're starting to ask questions and gather the information, in time rather than trying to react to potential problems. So again, just about gathering the information to I suppose to identify are there things that need to change, are there tweaks that need to be made, or is everything ticking along nicely?
That's great. Thanks, Finola. Thanks, Joris. One of the questions, I guess, to follow on from that, and you did talk a little bit about stress, and I think Joris, you talked about heifers very early on. There was actually one of the questions that came in a couple of times last night on the texting ahead of time. How best to manage heifers? And I suppose a question around people who are CMTing heifers as they're coming in or checking them, and a lot of the time heifers suddenly seem to be high all the time, or they've got a lot of high quarters. It's one of the things I was asked to ask you. Is that normal? Will they settle down? And where do you have to start to watch? Should you start to culture them? Should you start to think about treating them? Or how long do you see is it just a stress related piece? What's your best advice on that? Finola, do you want to take that one?
Yeah, it's a very valid question, and I think it's something we're probably becoming more conscious of and starting to ask more, or explore more. In relation to heifers, and again, I emphasise the point about kind of managing them calmly and keeping their stress levels to a minimum, bearing in mind, they've gone through a significant transition and change as well. Addressing any potential edema problems can be really important, and ensuring the nutrition of the heifers and also the hygiene. Sometimes, I see things are certainly moving and evolving all the time, but there probably was a time when they were maybe forgotten about a little bit, and just kind of introduced and brought into the herd. But we really need to mind them. They are, as Joris has already said, they're the future of the herd, and we need to do everything we can to keep them, to protect them and keep them as clean, stress-free, and minimise the bacteria as much as possible. In relation to that high SCC, yes, they often will have a raised SCC after calving, which can be for two reasons. One can be stress related, can be the normal composition of the milk post calving, and generally if we see a high SCC in all 4 quarters, that's more likely to be the reason, and that it can take 2 weeks for a raised SCC to resolve itself, or for it to reduce to a normal level. If we see one particular or maybe 2 quarters affected, then we're more likely to be leaning towards an infectious cause. And what we tend to see in heifers is that there are often what we call opportunistic bacteria. So bacteria that are on the teat skin, or even the skin of the legs or the udder, they take the opportunity. That's why they're called opportunistic, and they just enter through that open teat end. Again, traditionally, they're what we would have called minor pathogens in the past. So they're often pathogens or bacteria that the animal's own immune system will deal with. So in many cases, these infections are present, but the heifer her immune system responds and she deals with them, and there isn't any issue. There isn't necessarily any reason for or justification for treatment. I suppose as we learn more and as scientists, learn more and explore more, we're starting to realize that this group of what we called minor pathogens, which are some of the staphylococcal family. They're related to Staph aureus, but they're not Staph aureus, and they're not necessarily as persistent or as problematic. In the past, we've grouped them all together as what we call non-aureus staph, but we're starting to learn more about them and realize that they're not necessarily all equal. Some are more problematic than others. And yes, some of these may benefit from treatment, but really, until we start to gather some of that information, it's very difficult to know. So what I would encourage people to do is, if you are seeing, 1 or 2 quarters affected after calving, is take a mastitis sample. You may not need to treat that animal at all, and again, treatments are something that you should, discuss with your vet in terms of whether to treat and what to treat with. But what I would encourage you to do as a routine is to take a milk sample from those affected quarters, put the details on it, put it in the freezer and forget about it. And if after a period of time you realize you actually have had, quite a few cases or more than you're comfortable with, you now have a bank of information that you can actually explore and see, well, what bacteria have we been dealing with? Are they ones that are problematic and we need to be more proactive about in the future, or do we just leave them to the animal's immune system to deal with?
Right, Finola, thanks for that. Joris, anything you want to add specifically on heifers?
Specifically on heifers, no, I think that the stress is, it is an issue with heifers, especially, in some herds you might see heifers get trained very well into a parlour, but in other herds they actually come into the parlour the first time ever is right after they've been calved. But if they are calving ahead of the cows, it actually works out quite well. A thing that maybe we haven't mentioned, but Finola talking about the skin bacteria or the bacteria in the legs, what I sometimes forget about in a way, but we haven't touched on it now, this might be a good place, is clipping tails. And actually just increasing the hygiene level again, when you can prevent contamination of the udder, which is always a much better approach than trying to cure something afterwards or having to clean much. Actually clip the tails, and that's a big problem already sort of minimized, I would say, on that.
That's great. Thanks, Joris. And just a reminder to anyone that wants to send us in some questions, text us in on 086 180 3947 or just email us on questions@tirlanfarmlife.com. One other piece, you kind of touched on it a little bit at the start, but maybe just to sort of wrap that back up, because I guess this is the big one. With high cows that you had identified and you actually went and treated them during dry period, because that's usually the best chance of actually getting a cure. How do you manage them coming back in, and what should you do rather than just assuming that they have been cured? How do you establish if they've been cured or not? And then as well as that, what do you do if they haven't? I suppose, back to some of those decisions. How early should you take those decisions? And how much of a risk is it to actually keep them milking on if there is particularly Staph aureus infection or something? So maybe talk me through a little bit how to manage high cows as they're coming back in. So these are cows that went out, you did treat them, and you're thinking about what you should do with them next. Finola, do you want to take that one?
Yeah, so okay, you make a very valid point there. Let's not just assume that they've been cured, because the reality is a proportion of them will, but a proportion of them won't. And also what we have to bear in mind is that there's also the possibility of reinfection. So we may actually have had a successful dry period cure, but depending on the dry period management, there's, it is still possible for a cow to be reinfected again during that dry period. So gathering the information, so using a CMT and as a practice, and it's something that that will be recommended within the CellCheck farm guidelines. And again, going back to Joris's point, and we're not saying it will catch every single cow with a high cell count, but as a routine, using the CMT on a cow before she's reintroduced to the blood tank is a good practice, just as a screening. So it'll at least pull out some of the cows or identify some of the cows that may need to be withheld for a little bit longer. So from a very early stage, you're identifying the potential culprits. Once you know who some of those animals are, as I was saying earlier, preventing the spread, so making sure that they're not a problem for the rest of the herd, milking them last, is your most effective way. Segregating them, and milking them at the end of milking so that the machine is washed after they've been milked is the best way of making sure that they don't spread bacteria onto another animal. Cluster flushing could be an automated way of trying to achieve the same thing. So in other words, you're trying to disinfect the liners after you've milked an infected cow. Some people ask about cluster dipping, which the challenge or the difficulty with cluster dipping, while in principle it's attempting to disinfect the liner before it goes on to another cow, the reality is there can be an awful lot of variation in terms of how effective it is, depending on things like the disinfectant used, whether the clusters are rinsed out beforehand or not, how much contact time they have with the product. It's very, very variable. So I'm always cautious and reluctant to propose that, and also considering that again, it's a very busy time of year. It's another task to add into the milking routine, where, going back to Joris's point, having a good, steady, consistent routine is one of the most important things that you can do at the start of lactation. Again, an early milk recording is essential. If we don't milk record an animal, ideally within 30 days, but certainly within 60 days of calving, and even the 60 days might be a little bit generous, but it's, I suppose it's the reality of trying to be practical within our seasonal systems. We need to get a recording on a cow within at most 60 days of calving to know, to be able to say how successful was the drying off and the dry period. Once we go past that point, we can't connect the two anymore, because her infection status could just as easily be what she's now been exposed to during lactation, as opposed to her dry period management. So an early milk recording is essential if we want to identify the animals, that are still a problem, and also identify how successful our dry period decisions and the dry treatment decisions and strategy was. Once we know those infected cows, well, then I suppose it's difficult to say from here what we should do with them. Action needs to be taken, whether that's and again, in terms of treatment, if they've had a dry period, if they've had a dry cow treatment, then at this point in time, further treatment, if that wasn't successful, then really further treatment is not warranted, because if that didn't work, then there's not anything else that we can expect to work. You asked the question, how soon should we make decisions on them? As soon as possible, because the longer they're in that herd, the more risk they pose to the other animals. So decisions need to be made early. Ideally, we take them out of the herd as soon as we possibly can, but I accept the practicalities and the economics of that as well. So some of that may have to be managed, and it depends very much on the farm in terms of, how can they manage the risk of spreading to other animals, because some farms may be able to manage that reasonably well and buy a little bit of time or a bit of breathing space. For others, that may just, pose too great a risk. I suppose it's a difficult time of year, for example, to consider. It's not impossible, but it's more challenging to do things like drying off quarters, both from the perspective of the cow, only starting and kind of heading towards peak lactation, but also from the point of view of, milker management, and I suppose establishing a good routine. And bear in mind the history of these animals. Oftentimes, we know that these cows have been culprits for years, so we really have to make some hard decisions at times. And it's a brave step, but it is beneficial in the long run. What's the other thing I was going to say? Pass back to yours because I've forgotten it.
While you're thinking of that, I'm just going to really pick up that point. It is about that early identification, Finola, through milk recording and things like that, to actually really get on top of it really quickly. But it's also about, when you've got that milk recording information, making decisions about it and actually just not letting them drift along and do damage. So the one cow in herself isn't going to do damage. Maybe she might rise your bulk, but it's actually what she's going to do to all the rest of your cows as well to really consider. Joris, do you want to add anything to that? And then I've got a whole lot of questions after coming in, so we can flick to some of those.
Sure. What can we add to that? So I suppose that the high cell count cow, like I said at the start, she's the source of infection. So I fully agree with Finola. We need to be able to make those decisions quickly. Look, the timing of your milk recording, it's never going to be ideal for every cow in the herd. But if you let's make it a bit more practical, I suppose. If you're a January calving start, you really have to be looking at that first milk recording in the next week or two. That would be my approach. Okay, so if your calving starts in the first half of January, you probably should be looking at Valentine's Day for that first milk recording. If you start on the 1st of February with your calving, then you should at least have one done before St. Patrick's weekend. Okay, and that is for the reasons that Finola called out. We need to be able to catch those cows in the early weeks of the lactation. If we leave it any longer and they come out with a high cell count, we don't know whether the dry cow treatment was actually successful or not, because it could be a new infection that cow picked up in the first weeks of her lactation. So by catching them early after calving, we can actually say, okay, they had an opportunity to be treated during the dry period and they took it or they didn't. And if they didn't take the opportunity, well, look, the decision should be fairly easy. Now, herds can manage those cows quite well sometimes if they can segregate them, or if you have a cluster flush system that you know works. Again, having new fresh liners will play a big role in that. You can segregate those cows out maybe for a while, but they should be on the list to go and not be bred later this year. And other things come into consideration there as well. How are you for space? How are you for fodder at the moment on farm as well? And then look at cull cow prices. There's a lot of things to balance out, and maybe those cows would be better off not hanging around much longer, because they will do long-term damage. And actually right now mightn't be the worst time to be going. So I think for those cows, yeah, there's some hard decisions to be made, but actually I would not consider them very hard decisions in the end.
In other words, you're busy enough at this time of the year, so don't be giving yourself trouble long-term by not deciding. We've got a couple of questions that have come in, so I'd actually like to really run through some of those. One is an interesting one, and it's actually kicking back to the heifers again. How to deal with warts that are affecting heifers causing mastitis. That's literally just come in now. If somebody wants to give me a quick insight into that.
So warts are a viral infection. They're caused by there are various strains of virus that can cause them, and generally they're self-limiting, and they will resolve and the heifer will eventually grow out of them. The problem is, while they are present, sometimes they can be physically problematic and obstructive if a cluster is, particularly if they're near a teat end or if they're causing discomfort. There's really, unfortunately, there's no miracle answer for dealing or for getting the warts to disappear or to resolve quicker. Ensuring good teat skin condition. So plenty of teat disinfectant with emollient in it is really important, because they can be quite, they can get quite irritated. They can lead to sensitivity. But generally it's time for them to actually resolve, which is, it's not the perfect answer. But it is time, and that they're a self-limiting disease. If the reality is, if there's a candidate that has particularly bad warts, sometimes physical removal of them, depending on the type of wart that they are, can help. But again, depending on how close they are to the teat end, can also potentially cause some damage to the teat sphincter or the opening, which in turn can leave that animal more at risk of bacteria gaining entry. So I suppose they're somewhat farm specific, because some of that can also depend on the strain of the virus that's affecting as well. So it's something that I would get veterinary advice on too, depending on the particular cases that you're dealing with. The animals will, develop immunity over time, but in the immediate situation, so some of them may need to be managed differently.
Right. Thanks for that, Finola. Joris, question that's come in to us around milk recording, and is there any support available from Tirlán on milk recording? And I suppose, to represent the milk supply team, maybe you could also bring in the support that we give in actually getting people going on that. So just a question around milk recording for Tirlán suppliers.
I suppose Tirlán have taken the step of adding, or has been on the list for the sustainability action payment for a good few years, because I suppose we do see the benefit in doing the milk recording and looking at the results and identifying the cows that are, contributing to the herds and the ones that are a drain on resources within the herd, and that increases the the long-term viability and the sustainability of the herd. But the big benefit there is that, you know, you get a nice bit of support, and I think for the average herd, I think it's about €400 that it would come down to, the sustainability action payment, the bonus specifically for milk recording as one of the actions that you can take. I would look at that and say, okay, milk recording, and today we're talking about cell count, and that's where a huge benefit for milk recording is, obviously, in trying to manage cell count within the herd and your mastitis. But obviously, milk recording gives you a lot more information, gives you information about EBI, so you can use it for your breeding. So actually, using that as one of the sustainability action payment actions that you're choosing, it will actually also then allow you to do a few of the other actions that are on the list. So ultimately, what that means is, what I'm trying to say is that milk recording will actually pay for itself nearly purely on the bonus, even though everybody who has used milk recording knows that even if there wasn't a bonus, it is financially beneficial to do milk recording. You actually make money by doing milk recording. So that's something that I think we're quite strong on. And then I think our team of milk supply managers are there to help you get on top of a problem. And if you have the information from the milk recording, that makes our life much easier, because we have something to work with. We have data to work with and try and solve the problem and get on top of it. If there's no data, we're really at a loss as to where to start.
Right. Thanks for that, Joris. And yeah, just to shout out as well that actually any of the milk supply team or myself or Joris, we'll all help you go through your reports, particularly if you're new into milk recording, just to make sure you get the best benefits out of them. So lots of questions after coming in. So I try to run through them. Is there any link between high cell count and high TBC? Maybe Joris, do you want to take that one quickly?
Yeah, okay. So even though it's not necessarily animal related, the TBC, I do find that if I look at all the steps that you should do on farm to control cell count, that actually the same applies to your TBC, right? It's all about the hygiene, about keeping things in good order. It's about having the machine serviced regularly enough. It's about the rubber wear. It's about all those little pieces. And actually, when you put them side by side, it's nearly the same things you're doing, except that I suppose for cell count, for SCC control, you're obviously looking at your teat disinfectant, whereas for your TBC, you're looking at your plant cleanliness and disinfecting and so on. But actually, is there a link between TBC and SCC? Probably, maybe not directly, but the management of both of those on farm are very similar. So we'll often see that there is the link there might actually be the farmer, and that a herd that is struggling with SCC chronically might also have a TBC problem chronically, and that's sort of how I would look at it.
Okay, thanks for that. I've got another question here on pulsation, and it actually ties into the questions we got last night as well. So I'll actually try and maybe group them together, and Finola, I'll put them to you. It's all about pulsation. So I suppose first of all is, how important is the pulsation system in the vacuum reserve to keeping cell count low? And the second bit of the question then is, how often should you actually get your machine tested? And then it actually ties into a question that's literally just come in. So I heard that ran into cell count problems last year because of issues with pulsations and vacuum. How do they get cell count back under control? They've got the pulsation fixed, but how best to pull it back?
Okay, so looking at the first part of that first, how important. I'm not a milking machine expert. I don't claim to be, but the one thing I do know is that a well-functioning, well-maintained, and a machine that is used correctly and appropriately is essential for good udder health. So if there's any malfunction in the machine, or if it's not maintained effectively, or if it's not being used correctly, when I say used, for example, if there's over milking, or if there's poor handling, or the way in which the machine interacts with the cow is essential if we want to minimize the likelihood of physical damage to the teats and or bacteria getting into the quarter. So yes, it can be very relevant, and it can be a very important link, because it's what interact with the cow, so it needs to be working well. In terms of once a problem is resolved, so if we go back again to the principle of source and spread, so if a machine malfunction has been identified as the reason in which bacteria or mastitis was enabled bacteria to spread from one cow to another, or to contribute to new infections. If that has been resolved, and if that is the only issue, then the spread shouldn't be a problem anymore. However, we still go back to the question of, what is our source? You know, do we still have a source of infected animals? Just because a machine function has been corrected, it doesn't fix the fact that we may have been left with a legacy of some infected animals that we need to know about. We need to know who they are, and then we need to make the decisions on them. So we need to manage those to make sure that they're not a risk for other animals. So yes, it can, you know, once we fix the problem, we can then move on and get back to a good management situation again. But you know, again, let's not just assume that because we fix the machine, everything else will sort itself out. We need to be aware of potential, you know, residual or legacy problems.
Thanks for that. We're almost out of time, but the question has come in on cluster flush. Is there any particular milking machine that cluster flush is more effective on or more needed on? Finola, the question to you again there, and then we're nearly ready to wrap up. Or is cluster flushing suitable for all machines? You mentioned earlier that it's better than cluster dipping.
Yes, again, I'm not a technician, so I'm not aware of any incompatibilities or any sort of, I suppose, problems with fit or match. My understanding is that in principle it could be applied to any machine, provided that there are ACRs in place or also implemented or also installed at the same time. Yes, it is better than cluster dipping because of the consistency of it. It automates all the various components that are required for it to be effective, whereas for cluster dipping, all of those components are left to the operator to carry out. So there's the potential for a lot more variation, and potentially reduced efficacy. And I mean, again, depending on whether it's a solution for a farm depends very much on the farm, and it depends what the problem is on that farm. I don't necessarily recommend it for every farm because it may not actually address the problem. So again, these are conversations to have, with your vet, with your advisor, your machine technician, because they will know your farm situation and know if it's actually addressing the problem. Because what we need to be careful of is just solutions off the shelf because they exist, rather than picking the ones that are actually geared or targeted towards the particular farm challenge.
Thanks for that, Finola. And I think we might get one last question in. And at the end of this, just remind everybody, we will record it and we'll have it up online. And also there will be one on the 19th. And we're actually going to really go into bacteria and things like that. But Joris, a question for you from somebody who's been doing a lot of selective dry. How quickly can you put cows back into the tank after when they've not actually been treated? So back to the heifers as well, I suppose, anything that's not been treated.
Well, that actually then goes back to milk quality, is how I would look at it. And obviously everybody understands that the first milk that comes out of a cow is colostrum, so it's way too valuable to be going into the bulk tank and be processed. It should be going into your calves, and actually it's such rich milk that processing is very difficult. And even then, the next couple of days, the next 4 days, I would say, that milk, as it is transition milk, is still too high in butter, fat, and so on, that even from a processing perspective, it's very difficult to deal with. And that milk has its value, especially because it's coming out of animals that did not receive antibiotics. It's of such value to be going to calves. So why would you put it in the bulk tank? So I would say milk should only be going into the bulk tank on day 5 after calving. Whether or not that withdrawal of antibiotics is a concern. Obviously, if there was antibiotics used, you want to do out the withdrawal time there. But after 5 days, milk should be normal enough that it's milk for processing and no longer that transition milk that has much better use as a calf feed.
Before the technology cuts it off, there's a question here that's come in. Should the ACRs be switched off and set to manual for milking heifers at the point of calving during the transition piece going into the bulk tank? And a lot of different views around ACRs. Finola, do you want to give me a comment on that one?
Again, I would say it probably depends on the farm situation. I mean, the ACR is going to prevent over milking happening. it will prevent the overmilking at the end of milking. But again, coming back to heifers, I would say probably one of the more important things to focus on is teat preparation, and ensuring that heifer has a good letdown. Because, for example, if heifers are stressed, if letdown is poor and the cluster goes on, it doesn't matter whether the ACR is set or not. If there is no milk flow at the start of milking, we're then creating a situation of overmilking. So I would be more focused on teat preparation and ensuring a pleasant experience for the heifer, and minimising the stress and any discomfort, rather than necessarily having a black and white recommendation as to whether ACR should be turned, should be set, turned off and set to manual or not. There may be reasons on some farms for doing that, but as a practice, I think I would, I suppose, approach that on a farm by farm basis. But like I say, to me, the priorities will be ensuring good milk letdown and comfort of the heifer for starters. Everything else then should fall into place thereafter.
Right. Thank you for that. I think we're out of time. So just a reminder to everybody, we're going to do another of these short sessions on Monday the 19th at 1:15 p.m. and we're going to really take a close look at bacteria and causes of mastitis, and maybe dealing with some questions that you might have about things that are actually starting to occur in farm. So please get in touch with us before that. Our website, tirlánfarmlife.com, will have the links to this webinar to listen back to this evening. And I've also got a couple of videos that we're just finishing off with Don Crowley, and they'll be available as well for actually, again, guides on best practice through calving. So thank you very much for coming in. Thanks to Joris and Finola for giving their time to me today. Hopefully you found it useful, and we look forward to chatting to you on the 19th. And thank you very much.